Hello, my name is Ethelda Clarke, and I would like to say first, please excuse my voice and the nasally sound because for the past couple days I have been under the weather, which brings me to the point of immunizations. And I honestly did not get a flu shot. So, whatever I'm going through, I'm having to get over it by whatever means. So, my speech is on the measles, of which when I was younger, I had already been vaccinated. Now, I was born in 67, and I know that I was vaccinated for measles, mumps, and rubella. And I also um, contracted those diseases as well. But measles is the one I wanted to speak about today because of the outbreak in California. Measles is one of the leading causes of death throughout the United States, throughout the globe. At least 146,000 people have died from measles, and a large number of those individuals who died were children under the age of 5. That is very surprising. Since the beginning of the year, over 100 people from a number of states have been affected by measles after visiting Disneyland, like I was saying in California, they contracted the disease. And it was thought that maybe people from outside of the United States had visited the theme park and maybe the individuals had come in contact with the individuals. Um, Measles is actually a preventable disease when immunization has occurred. So, according to the CDC, which is the Center for Disease Control, a large number of the individuals who have contracted the disease are the population that are unvaccinated, are part of that population. So, measles, how I would like to tell you a little something about the measles. It's a virus and is transmitted by direct contact. It's extremely contagious, marked by a rash, little red bumps on the skin, fever, runny nose, pink eye, coughing, sneezing, perhaps, and it lasts from 2 to 4 days. The individual um, can be still contagious 4 days before you actually see the symptoms until 4 days after the symptoms are no longer visible. They can still be contagious. The virus can live in the air and on surfaces. So, if an individual has measles and they are in close proximity and they leave the area, whatever they did, touched, or if they sneezed into the air or coughed, those droplets are active, they're live. The spaces that they touch, if you touch it, and you're not, if I'm touching the table right now, so if I touch my face, I have it. And that's just it. So I would say, and for that, it stays alive for 2 hours. 2 hours, it's alive. And just think of the amount of people passing in that space. 2 hours. Now, as far as being vaccinated for measles, and I know there are people who don't get vaccinated at all. Um, According to the ACIP, which is Immunization Practice Advisory Committee, the measles vaccination should be given in 2 doses, administered first in high risk areas at 15 months, and is the first dose between 12 and 15 months. 15 months would be for high risk. 12-month would be normal communities or whatever. And the second dose would be administered between the ages of 4 and 6. So basically, if you are to be vaccinated, those 2 doses should occur within the first 6 years of the young person's life, basically. In conclusion, I would like to say that measles is the number one reason for deaths in early childhood with children under the age of 5. It's very contagious. The Immunization Practice Advisory Committee recommends 2 doses, 12 to 15 months of age, and then again at 4 to 6 years of age. With the first, basically within the first 6 years of life, in order to be adequately covered. The thing is that if you are vaccinated, the chances of you contracting the disease is less than if you're not vaccinated. And considering the measles is very contagious, has been seen to cause deaths, then immunization is probably the best possible weapon against measles. Thank you.